was about to say good morning, but I realize it's not morning anymore. So I'd like for you to imagine that our nation's C-section rate is below 15%. Inductions are used only for medical indication. Decision-making isn't driven by liability and profitability. And midwives are doing the majority of births. And they are autonomous. I really believe in the power of intention, and so I ask you to really hold that vision. And even beyond today, I want you to take that vision home with you, because I believe that it would be very, very powerful. According to the recent Listening to Mothers survey, 9 out of 10 women receive care that increases rather than decreases the risk of harm for her and her baby. Decision about their care is often determined first by liability, profit, and convenience, rather than what is safest for mothers and their babies. 1 out of 3 births ends in major abdominal surgery, with half of them considered preventable. We spend $98 billion a year on maternity care and still have some of the worst outcomes in the developed world. This number hits our communities of color especially hard. I know that none of this is new to you, and I'll get back to it in a little while. Ginger shared a little bit about me, but I'm going to wind up going over some of the stuff that she talked about. My name is Thompson. I'm the founder and president of ImprovingBirth.org. I'm a mother of 6, plus raising my 16-year-old niece, who is also featured in this image. My neighbor said that I struck the genetic lottery with my children. I would have to agree. We live in San Diego, California, and I've been a birth worker for the past 10, actually going on 11 years, helping close to 300 families through the labor and postpartum period. And as a doula, I experienced incredibly empowering births, but I've also experienced violating, traumatizing, and incredibly brutal birth. And sometimes it's just been moments of misinformation being given to the client. And in other times it's just been extreme. And really everything in between. In the need for self-preservation about 6 years in, I stopped working at certain hospitals and only started working with certain providers, just because the feelings of frustration and disappointment were overwhelming. And I had to protect myself. I could no longer feel that I could protect the mothers from some of the providers in my area. 2 years ago, I was approached by a reporter from a local weekly newspaper who was doing a story on one of our local hospitals' C-section rates. It turned out that the editor of the paper had just had his baby at this hospital. And the doctor walked in, getting ready for delivery, and he just flippantly said, you know, it's a good thing I was the one on call today, because if it had been Dr. So-and-so, this would have been a C-section. And the father was just absolutely stunned and upset by that. And he just said, well, why? Is there something wrong with my wife? And he said, oh, no. That's just how this doctor works. It's past 5 o'clock. And then the doctor said, don't you know we have one of the highest C-section rates in the state of California? He obviously didn't know who he was saying that to. When he got back to work, he got one of his reporters and asked her to do a story on this hospital C-section rate. And she went back and said to him, after doing some investigation, this seems to be a problem everywhere. It's not just this hospital. Why don't I just do a story about the C-section rate? And he said, do you want this to be a big story or a little one? He said, I want you to focus on that hospital. And so she did. And I interviewed for that for many days. It was a very big interview, or a very big article. It wound up being a 5-page spread, and this is the cover of the paper, and it's sold out everywhere. So we had learned a few years before from an insider at the hospital that the C-section rate at this place was around 80% on Thursdays and Fridays. So the hospital, of course, says that the reason that their C-section rate is so high at their hospital is because they do the high risk and they deliver the most babies under 1,500, blah, blah, blah. But of course, the research shows us that that only counts for about 6% of their business. So fast forward, when we heard that news, as a group, we had planned to protest outside this hospital. And we had a date pick and everything was ready to go, and the tsunami hit the Sri Lanka area, and obviously, we recognized that this probably wouldn't be a good time to complain about our C-section rate. So we canceled that event and mourned the loss of thousands of people instead. Fast forward now a couple of years, and this opportunity for this article comes out, and I'm a big part of it, and so I have the information to understand that it's going to come out. And I have a background in marketing. Before I was a doula, that's what I did. And so I knew the importance of taking advantage of an opportunity like this. So with prior knowledge of when it was going to come out, we organized our first rally. Unfortunately, the article came out a week before Christmas. And yes, that is San Diego, a week before Christmas. I do have to say it was raining that morning, but the clouds parted and we all came out and had a great time. 75 people did show up. This is a picture of the group. Unfortunately, a lot of people had left before we finally took it, but it was still a good representation of what we were doing. During the planning process, a fellow doula said to me, "Wouldn't this be great if we could do it all over the country?" I said, "Well, we don't have time to do it right now with this one." And she said, "Maybe we could pick a big date like Mother's Day." And this was in December. And I said, "No, Mother's Day is too close. But Labor Day, that gives me, about 9 months." So the national rally, it was originally called the National Rally for Change because I originally was going to call this changebirth.org until I met with Ina May Gaskin, telling her excitedly about this idea that I had for an organization. And when I said it's going to be called changebirth.org, she just raised her eyebrow. And I didn't say anything, but I knew in that moment that that was the wrong name. She said, I knew she was thinking, I was like, I swear her brain was talking to my brain and just said, "We don't need to change birth." So anyways, eventually we became Improving Birth, but that's a whole nother story. So the hospital heard about our plan to rally and immediately contacted me and asked for a meeting. The meeting actually went pretty well. Turned out that the CEO and the head of nursing had actually both had their babies unmedicated in birth centers in the 70s. As a direct result of this meeting, the article, and the subsequent rally, the hospital has responded very positively over the last 3 years. They redesigned their website, and the reason that they did that, because much to their embarrassment, we pointed out that the very first subject on their very first subject on their website was all about cesareans. They changed their triage guidelines. Before, they separated mothers from their labor support. They would allow only one person to go back with the mom, but these women have been laboring at home for hours with this doula, and they would be separated from their doulas, and sometimes even for hours. And oftentimes the mother would magically have an epidural before the doula got back up into the room with her. They have changed that since then. They also started an in-hospital doula program. Not sure how I feel about this one yet. We'll see. It's still a control issue, so we'll see. But I feel like it's a step in the right direction. They also started a marketing campaign. All the radio ads right now are birth your way and about having natural birth and doula-supported birth. So it's, they still have a pretty high C-section rate, but this is, at least from a marketing standpoint, heading in the right direction. So in 9 short months, using only social media and a budget of $0, we organized 110 locations in 46 states. And I got some crucial help at the very in the final weeks. I created a rally toolkit because I knew that women really wanted to do something. They just didn't know how. So I created a rally toolkit. I created a checklist of what to do 2 weeks out, 6 weeks out, a month out, who to contact. We wrote their press releases for them, and we provided all their marketing material, including a slideshow that they could show on social media. So we raised just enough money, by the way, through crowdfunding to cover our expenses. We raised a tremendous amount of local media attention. It was very obvious that we had struck a chord. Mothers wanted and needed to be heard. In the past 2 years, we've been pretty serious about creating a brand that is joyful, non-judgmental, and about coming together and saying that we can do better. We've worked really hard to become a powerful voice of mothers for mothers, with hundreds of volunteers across the country, a board of directors, and we received our 501(c)(3) status last year. I'd like to just share Sherry's story with you because she's one of the people that was affected by our rallies. Just a few days before our first rally, Sherry was invited to our rally because she had just found out she was pregnant with her second child. And she had experienced a pretty traumatic birth with her first one. She did the typical thing. She was induced at 40 weeks and went down the snowball effect and ended up in a cesarean. And she assumed that the only option was a repeat cesarean until she came to our rally. Her girlfriend, who she had expressed had just found out that she had told that she'd just been pregnant, invited her to the rally. And she tells the story. She actually did a video thank you to us after the rally. She said that she stood there with tears rolling behind her sunglasses as she held her VBAC sign at the corner of the street, and people honking, and she realized that she could have a VBAC. Not only did she have an incredible VBAC with this little chunky guy, but she also has gone on to start 2 ICANN chapters since then, and a Birth Network national chapter. Our 2013 Rally to Improve Birth went global this year with 170 locations. She talked about it a little. All 50 states, including Canada, Australia, and Japan. And over 240 news stories were done. Sorry, that's going, oh well. The amount of press that we got was astounding. Almost every location got at least 1 media outlet to cover the story. Most of them had 3 or 4, and aside from 2 publications, the news reports and messages that we got were consistent across the board. And mostly that was because we did media training with our coordinators this year and had them stick to those reality checks that I was talking about, those 4 talking points. I'd like to share a little bit of some of the images from that day. Some of you might recognize that amazing woman right there, sitting out there in her chair. And by the way, it was raining, pouring down rain in Philadelphia when she was out there with her amazing sign. Kitty has been instrumental in helping us reach the midwifery community, and she's instrumental in why I'm standing right here. She's been an incredible partner, and I don't think she's here today, but I absolutely adore this woman, as many of you do. So I'd like to talk a little bit about what we're doing now beyond the rallies, because a lot of people still think that's all we're doing. We recently completed our strategic planning process, and now we are in the project planning stages of a community advocate program. With the initial launch in January of 2015 in 5 cities, with a goal of expanding to at least 15 cities in June. This will be a 6-month training program with several different training modules. If there's one thing that we've learned from the rally is that women want to do something. And so we're hoping that by creating this program, it'll give them the power and opportunity to do something. So based on a very successful program by the Australia Maternity Coalition, they've been amazing and guiding us through this process. We'll be training participants how to join committees in hospitals as consumer representatives. We'll be teaching them communications and media skills, and we'll be teaching them presentation skills and giving them materials so that they can reach the high schools and college-age students in their communities. And so far, we have several collaborating organizations working with us, Evidence-Based Birth, VBACFacts.com, and Choices in Childbirth. Another priority for ImprovingBirth.org is to proactively work to engage stronger participation in our activities and programs with women of color, while recognizing and addressing the enormous racial and class disparities in maternity care. We hope to collaborate with Jenny Joseph and her Common Sense Childbirth program to get her program in more cities across the country. I'd also like to take a minute to bring attention to a lovely woman in the audience. Her name is Sherry Payne. I didn't tell her I was going to do this. Sherry is a perinatal nurse and a Frontier University hopeful. Anyone who's reading her application? This incredible woman will be walking across her state of Missouri. She'll be walking from Kansas City to St. Louis to bring awareness to the issue of black infant mortality and to raise funds for her Uzazi village. If you don't know what that is, please look it up. Uzazi! And Uzazi's village is to eliminate racial disparities in perinatal outcomes, and this event will be September 1st through the 15th. I'm hoping that ACNM and Frontier University will get behind her and be sponsors for this event. Sherry, why don't you stand up? Can you stand up for just a second? There you go, there she is. So I'd like to take a little break and have you all do a little exercise. Can you please stand up if you've heard of ImprovingBirth.org or the Labor Day rallies before you got here this week? It's good, all right. Can you stay standing if you've attended a rally? If I do this again next year, better be a whole lot more people standing up. Can you please stand if you've donated or been a sponsor for Improving Birth? We're going to work on that too. All right. So earlier I went through the reality checks. By a show of hands, how many already knew these statistics? Yeah, probably every single person. But the mainstream has no idea. They're completely oblivious to the fact that there even is a problem. And we believe that when they figure it out, there's going to be a tremendous amount of pressure to change this maternity care system. And the reality is, we can do significantly better than this. So the message is certainly making its way into the mainstream media, with major outlets like CNN, New York Times, Washington Post, and Consumer Reports most recently, reporting on these issues. I'd like to share Erin's story. Erin's story always kind of, it cracks me up, but then it's terribly sad. Erin saw us, and I relate it to the news stories because Erin saw us on the news at our first year's rally. And her words were, "What are those nosy, yoga ball bouncing hippie women trying to tell me how to give birth?" She was 7 months pregnant at the time. She was absolutely and totally offended that we were standing out there with our signs. Now, Erin is an incredibly intelligent woman. She's a political strategist in Washington, D.C., working on some of the biggest campaigns in the U.S. She proceeded to have her baby 2 months later. She had a pretty quick birth for a first-time mom, about 7 to 8 hours, only pushed for 13 minutes. The doctor, she jokingly says that I should have had 4 centimeters epidural tattooed on my forehead because that was my plan. As soon as I was 4 centimeters, I was getting the epidural. So that's what she did. She got to the hospital, but she was already 5 centimeters. She still got that epidural. The doctor came in, put her legs up in the stirrups, and draped her legs. They were encouraging her to push, the 1, 2, 3, 4, 5, 6. Anyways, I hate directed pushing, by the way. And they said she was doing great, keep pushing, lots of encouragement. And out came her baby, and she was holding her baby and noticed something wasn't right. And she said to the nurse, what is that on the top of her head? And the nurse said, "Oh, that's a hematoma from the vacuum." And she said, "But why did he use a vacuum? Was there something wrong?" And she said, no, that's just his thing. And he cut an episiotomy, and he used the vacuum. There was absolutely no informed consent, nor was there any indication that there was anything wrong with the baby that would require that 13 minutes of pushing to be. Erin felt incredibly violated, and she actually suffered from PTSD for quite some time and would wake up in the middle of the night screaming, having dreams of not being able to protect her baby. Needless to say, she suddenly didn't think we were so crazy, and she came and found us. And she wrote me the most unbelievable letter, an email, and she investigated us thoroughly before sending that email, by the way, as a political strategist should. And she joined our team, and she now, for the last 2.5 years, has been an incredible advocate for our organization. And she writes a good number of our press packets, and she takes care of most of our press and our PR. And she's just been an incredible gift. But this is an example of how, you think that nothing's happening when you're out there, holding your sign on a street corner. But it's women like this. And she's just one story. She's just one story of the women that we hear from after every rally. So how do we continue to reach the mainstream? How do we educate them about physiologic birth? We reach them by creating a well-crafted message. Unfortunately, the majority of women don't know that they have options, and/or that there's a difference between obstetrical care and midwifery care. Many of them don't even consider midwifery in hospital a viable option, and some of them don't have the option at all. But before we can reach them about their options, they need to know that there is a problem. And that this is just how things go mentality is hurting them and their babies. So I can't express enough how important social media will be for transforming maternity care. This is the game changer. Good or bad, the information is right there at their fingertips. And people are coming together in a whole new way. They're sharing information, and more importantly, they're sharing their stories. They're coming together to support and encourage each other. Improving birth has grown very organically We've gained 17,000. We did pass 17,000, by the way, since in the last week. We're about 17,100 something already. Wait, 17,700? Wow. In a few days, just saying. The followers our Facebook page, and the majority of them are mainstream moms. We originally started out, as you can imagine, with the majority of them being birth workers, but that has since definitely swapped and changed. Our website in a 1 month period has had as much as 100,000 unique visitors. And I recognize that this isn't really a big number when we're looking at the big picture, but when we consider about how short of a period of time that this amount of people becoming known about what we're doing, that this number will grow rapidly. Especially if we make it into, I'm gonna be on the Today Show, girls. I'm gonna be on the Today Show. Just gonna set that intention right now. Does that sound arrogant? I didn't mean it to sound arrogant. Yeah. Excuse me just one second. It's really dry here in Colorado, folks. So we call Improving Birth an advocacy organization because that's just a phrase that's commonly used. But really, we're a self-advocacy organization. We want to give women the tools and information and courage to be the decision makers in their care. Improving Birth's mission is to bring evidence-based care and humanity to childbirth. We started out talking about evidence-based care, but then we realized that we needed to add the second part of our mission after we recognized that evidence-based care means absolutely nothing if women don't have the right to choose it. So we put this chart together along with Dr. Decker of Evidence-Based Birth. If you don't know about evidence-based birth, please go there immediately. It is where your mothers and your patients are going for information. Comparing our current routine practices versus what research tells us. You can actually find this chart on our website and with full references, but I'd like to just focus on the first couple of things. If we just focused on a couple of things, induction and VBAC, it would have an enormous impact on the numbers of surgical births. The three most common reasons that we hear from mothers about induction are for big baby, postdates, and low amniotic fluid. Although big babies are only born to 1 out of 10 women, the 2013 Listening to Mothers survey found that 2 out of 3 American women had an ultrasound at the end of pregnancy to determine the baby's size. And 1 out of 3 were told that their babies were too big. In the end, the average weight of these suspected big babies was 7 pounds, 13 ounces. Of the women who were told that their baby was getting big, 2 out of 3 said their care provider discussed inducing labor. 1 out of 3 said their care provider talked about planning a scheduled C-section because the baby was being too big. 67% of these women whose care providers talked about induction for big baby ended up being induced, and the rest tried to self-induce. Nearly 1 in 5 women said that they were not offered a choice when it came to induction. In other words, they were told that they must be induced for their suspected big baby. When care providers brought up planning a C-section, 1 in 3 ended up planning that C-section. 2 out of 5 said the discussion was framed as if there were no other options, and they must have a C-section. I, of course, could go on just on this subject for a long time, but we know that shoulder dystocia is the #1 concern for big baby. And although big babies are higher risk for shoulder dystocia, most cases of shoulder dystocia happen in smaller babies. And unfortunately, researchers have found that's impossible to predict who will have shoulder dystocia and who will not. This is a practice that just has to stop. Postdates. There might be some people who contest this one in the room. Not 39 weeks, not 40 weeks, not 41 weeks and 4 days. 42 weeks is what the literature says is considered post-dates. Yet, according to the Listening to Mothers survey, almost 50% of the women surveyed had their labors induced before 42 weeks gestation with no medical indication. Another practice that has to stop. 91% of physicians believe that low amniotic fluid is in an otherwise healthy pregnancy at term was a risk factor for poor outcomes. Yet, according to research, poor outcomes are due to complications like preeclampsia, intrauterine growth restriction, and women going past 42 weeks, not low amniotic fluid. There is no evidence that low amniotic fluid at term is a risk factor for poor outcomes. However, induction for low fluids has proven to lead to higher C-section rates. Vaginal birth after C-section is obviously near and dear to my heart. Major organizations like the NIH and ACOG use words like safe, reasonable, and appropriate to describe vaginal birth after cesarean for most women. The American Academy of Family Physicians states that every eligible woman should be offered a VBAC. Often women who do attempt a VBAC, out of the women who do attempt it, 3 out of 4 will give birth vaginally, according to the research. And yet, 40% of hospitals in this country have a VBAC ban, and or women can just not find a supportive provider. And even when finding a supportive provider, they're often given unfounded restrictions, like needing to go into labor by 39 weeks in order to have a VBAC, or trial of labor. Sorry, I should correct that. And yet 90% of women in the US, according to the current numbers, who have a primary C-section will all have future children made via abdominal surgery. It's not okay. If we could just get back to the midwifery model of care and allow for physiological birth to be the first path and use life-saving interventions only when necessary, we would make a huge impact to not only the numbers, but the emotional well-being of mothers and babies. So the next part of our mission was humanity and childbirth. To us, humanity means many things: respect, dignity, and the right to be the decision maker of their own births. Informed consent means that they're given all of the information about any suggested treatment in order to make an informed decision. The risks of harm, potential benefits, alternatives, and the right to refuse care. We believe that when women are informed and supported, they can and will advocate for themselves and their babies. We believe that this is the only way that maternity care is going to change. When the users of the care, the consumers, the mothers, demand it on a massive scale. I was supposed to click when I started that slide, sorry. Unfortunately, change is difficult. As women become informed and start requesting evidence-based care, they're not always being treated with respect or humanity. Through our hotline and in partnership with Human Rights in Childbirth and the Birth Bar Association, we hear from women all over the country on a weekly basis being threatened with child protective services and court orders to coerce them into procedures that they do not want. Ashley is a perfect story of being pressured and coerced. Ashley is a 23-year-old mom, single, dad is kind of in the picture, Medicaid. She had gestational diabetes, but controlled it through her diet. And when they did an ultrasound, the ultrasound found, just at 39 weeks, at 38 weeks, found that the baby was only about 7.5 pounds. So she decided to, and they were insisting that she do an induction at 39 weeks. And that just didn't feel right to her. So she started looking around and found the article by Evidence-Based Birth about gestational diabetes and decided that that's not what she wanted to do. She felt that she wasn't having this huge baby. Everything about her health was online, and she was doing great. So she had reached out to us to find out what her rights were in this situation. Could she decline that induction? And we'd been talking to her, and Kristen Pasuchis, who's my VP, is the one who runs our hotline. And so we'd been having all these conversations, and spontaneously, the day before her scheduled C-section, guess what? Her water broke, and she went into labor. She arrived at the hospital at 5 centimeters dilated, doing fantastic. She labored at home as long as she could, always intended on going unmedicated. When she arrived at the hospital, her provider was on site and immediately came in and said, we need to start Pitocin immediately. She was having regular contractions. She was 5 centimeters, and didn't understand why she had to have Pitocin and refused the Pitocin. And her doctor basically said, I've never delivered a baby without Pitocin. And your water's been broken for 3 hours now. So not only do we need Pitocin, but we need antibiotics too. And this mama refused. She called us. Her boyfriend wasn't there. She had absolutely no support. And we got on the phone with her. Kristen and I tag teaming. I was on the phone with her. It was a Sunday afternoon. I'm out with my family at a park. I'm on the phone with this mom who's laboring and talking her through. I'm being her doula via the phone. And every couple of hours, the provider came in and pressured her and kept saying, you're going to hurt your baby, using descriptions that are absurd, quite frankly. And we finally stepped in as an organization because this mom, every time I'd call her, she'd be crying and saying, I just don't understand. Why are they doing this to me? And they'd say, have you made up your mind yet? And she'd say, yes, I don't want Pitocin. And she got stuck at 6 centimeters, of course, which then made the push even harder. Thankfully, she had an amazing nurse who basically wound up turning into a doula for her. But eventually, we called around and we found a doula that drove for an hour to go be with her. Unfortunately, I back up a little bit. I called the hospital and talked to the head nurse with permission from Ashley, of course. And she confirmed with the patient that she could talk to me. And our lawyer got on the phone with the patient advocate. And I said, I want to make sure that I understand the story, because I understand that she could be telling me one thing, and the reality of what you guys are dealing with is different. Tell me what's going on. And I said, please confirm what I can tell you, is actually what I said. And she said, mother and baby are doing beautifully. And she was very open to this conversation, and then suddenly it changed. And there was someone talking behind her, suddenly asking about my credentials. And who was I? And the conversation, this open, wonderful conversation with the nurse stopped. And we hung up the phone. Unfortunately, this had no effect on how much pressure they continued to put on Ashley. And unfortunately, Ashley's phone died. And so she no longer had this line to the outside of support. So here comes the doula. The doula shows up, tries to enter, and the hospital tells her that there's no one under that name in the hospital. They tell Ashley later that she checked the box that said that her information was left to be private, which of course Ashley says she did not do. Story ends well, bawling her head off with not only her doctor, but now the head of OB in her room, pressuring her to get Pitocin. She said she just broke down sobbing and agreed. And they started setting up the Pitocin. The bag was being hung. And then she begged them to check her because she felt like something changed suddenly. And they checked her, and she was 8 centimeters. And she felt strong again. And she said, I just need to go to the bathroom really quick before. And the nurse winked at her and said, let's go. And they went into the bathroom, and they sat on the bathroom on her hands and knees until she started to push. Ashley went on to have the birth that she sort of wanted, at least the goal of being unmedicated. But she has suffered from tremendous depression since her baby was born. And she really said that she initially wanted to file a complaint and all of that, but she just hasn't had the strength to do it, which is what we run into often. These women don't file complaints because they want to disassociate themselves from their birth experience. So we love the quote, when you know better, you do better. It's actually on our logo. But do we? Improving birth is here to engage the consumer, to begin closing that gap between what we know and what we do. We need less technology, and we need to get back to normal physiological birth whenever possible. This is not to say that we don't support interventions when medically necessary. We just need to strike a balance. So remember that vision that I had earlier in the beginning? The lower C-section rate and induction rate? We know how to get there. Now, the decision-making not being determined by liability and money is a whole nother can of worms. The American Heritage Dictionary describes an autonomous individual as one who's not controlled by others or by outside forces, independent. Independent is in mind or judgment, self-directed. I can stand here and talk about supervise and collaborate. You all know what it all means, and you know you're living it. But if our mothers are going to be requesting and desiring autonomy, so must our providers be autonomous. I have a provider friend who shared a story with me. She was respecting a mother's autonomy. This mother was a VBAC after 2 C-sections. Her BMI was less than desirable, but this mother had read and signed and discussed her risk factors and her understanding understanding the whole picture. And this mother decided that this is what she still wanted to do. And this provider stood behind her. She had a uterine rupture. Thankfully, mom and baby were fine. It was immediately taken care of. She was being monitored very closely. They'd handled the situation. Her administrators and her bosses didn't like that very much. And she had to go in front of a committee. She was written up. They told her things like, you should have forced that woman into a repeat cesarean. You should have never let her go for a trial of labor. The mother was perfectly happy. She understood the risks. She made the choice that for her, at least a trial of labor was better. And this provider, by the way, who's an obstetrician, not a CNM, was ridiculed and had to defend herself, which to me, as a mother, and I'm coming at it as a mother, it is not okay for you to rip my midwife a new one because of the decision that I made. It's unacceptable. I am a human being who has the right to choose who, where, and when I give birth. Sorry, it gets me all riled up. So I'm not going to stand up here and pretend that I can even begin to understand what you guys are up against sometimes. But I do know what the mothers are going through because they're telling us. We know that there's incredible division among midwives, although I'm very excited to hear some of the stuff that I heard this weekend. But we sincerely hope that during this process, that the right to choose where and with whom we give birth is at the forefront of all of these matters, that the consumer voice has a place at the table. And we also know that most of you have been fighting this fight for decades. Well, a long time, and some for decades. I really want you to feel encouraged. You aren't alone. You haven't been fighting this for nothing. The mothers are gathering. We're here with new energy, new people, and we're ready to do battle, and we're not going away. So what can you do? First, I'd like you to take out your phones and go like us on Facebook right now. Yay. Probably accounts for that 700, I'm guessing. And also visit our website and join our newsletter to keep up on what's happening and what we're doing. And also, engage your current and previous patients. This is a consumer movement. And the more consumers that we have, the better we're gonna be. And I know you can think about your patients who are passionate about midwifery care. Those are the ones that I want you to engage. Find them, email them, talk to them, tell them to join our team. Organize a rally. Most of you are gonna be like, yeah, right. Like I have time for that. But you can also at least attend a rally. Our first year, we were in front of hospitals. We heard from the midwife community that they couldn't attend if the rallies were in front of their hospitals. And so we won't rally again in front of hospitals so that you can participate and that the nurses can participate. But I hope that you will consider, there's 2 dates this year. We have it on Labor Day and also the following Saturday, which is the 6th, because some towns are deader than a doornail on Labor Day, just so you know. Many of you might not need this reminder, but you are all on the front lines and often work within a system that's difficult to change. But you are the ones who can continue to encourage the system towards family-centered, non-physiologic care. You also have the greatest opportunity to change the experience for the mothers. I know sometimes it's difficult, but whenever possible, put the woman in the center, not the technology. And understand that these women have the right to choose, even if it's not what you would choose for yourself. And always a tough subject to discuss, money. There's plenty of money behind the status quo and driving the existing incentives. If we're serious about making our voices heard, we've got to make a personal financial commitment to fund effective advocacy. So are you serious about changing the system? I challenge you all today to determine a monthly amount that's meaningful to you, to give it to an advocacy organization. It doesn't have to be ImprovingBirth.org, although that'd be fantastic and we sure would know what to do with the money. But give it to an organization that speaks to you, that you feel is making a difference in maternity care. And really think about it. Is it $5 a month? Is it $75? Is it $200? You make a greater impact when you make smaller, manageable donations over time, rather than just a one-time $25 donation. And most of the organizations out there have a system in place. I really ask you to consider this. We must keep our eye on the prize, the safety and well-being of mothers and babies. And having them just walk out of a hospital alive isn't enough. I'd like to share a little photo project that we did leading up to our rallies last year, actually. That video always makes me terribly emotional. I'm going to end with something Ginger read earlier. This movement is simple. It's not about natural childbirth versus medicated birth. It's not about hospital birth versus birth center or home birth. It's about women being capable of making safer, more informed decisions about their care and that of their babies when they're giving full, accurate information, including the potential harms, benefits, and alternatives. It's about respect for women and their decisions in childbirth, including how, where, and with whom they give birth. And most importantly, it's the right to be treated with dignity and compassion. Thank you very much for your time.